Well, good morning. Thank you for joining us today. I'm happy to be here with our partners in public health. I think it's appropriate that we travel around the state and go to the health districts. We're not going to all of them, but we're going to 4 today. From the beginning, we said we would shift to a more localized approach in our response to COVID-19, and that's what we're doing. I don't see any of them. I appreciate the mayors and county commissioners across the state who are helping to deploy resources within their communities to keep us strong. We've made $94 million available in federal coronavirus relief money to local governments, money they can choose to direct to support local businesses. These local leaders know their communities better than anyone. They can identify how best to support businesses impacted by COVID-19. Also, our strong state-local collaboration is playing out in school districts across the state. We provided, that's the governor's office and the state board, a framework for safe reopening of schools, and we're doing everything we can to support local officials in their decision-making. I appreciate the collaboration and the dialogue that we've had with every one of the 7 public health districts across the state, including Russ Duke here with us today. We are seeing increased spread in Ada, Canyon, Twin Falls, Bonneville, and Kootenai counties. The rise in confirmed cases in those areas is very concerning, but it is not the only metrics by which we make decisions in our coronavirus response. Our goal all along has been to slow down the coronavirus spread so our healthcare facilities, where's my chart? Director Jepson's on my chart, so our healthcare facilities aren't overrun with too many patients at once. We're seeing increased hospitalizations in certain parts of the state, but statewide, our healthcare capacity is holding. We are not where we want to be with our coronavirus situation in Idaho, but we have many things in place to get us where we need to be. We've increased testing, contact tracing, the availability of PPE for healthcare workers, businesses, and schools. But the one thing that will dramatically slow the spread of coronavirus is for every single one of us to wear a mask. I couldn't agree more with President Trump. Wearing a mask is a patriotic thing to do. Wear a mask to show you want a strong Idaho and a strong America. Wear a mask if you want our kids to go back to school in August. Wear a mask so our economy can continue to rebound. Wear a mask so we can maintain capacity of our healthcare facilities so no one has to make the difficult decision about who receives care when resources are limited. Wear a mask to protect lives. There is a mounting body of science-based evidence on the effectiveness of masks in significantly slowing the spread of coronavirus. I understand it's not comfortable, and it still feels strange to interact with our faces covered up. But it is a minor sacrifice we can make to restore health and prosperity to our state and to our nation. Today I'm announcing Idaho will remain in stage 4 for another 2 weeks. We will continue to move forward with a local approach on our coronavirus mitigation response, and I appreciate partnership and open communication we've had with our public health districts on a daily basis. With that, I'll have Dr. Hahn explain our statewide metrics, and then Central District Health Director Russ Duke will say a few words, and then we'll take your questions. Dr. Hahn?
Thank you. I don't have my visuals to show you today, so I'll just mention that we will have our metrics on our webpage later today. And also that we, as the governor mentioned, we are staying in stage 4. We saw a definite increase in our emergency department visits for COVID-like illness, which is one of our showstoppers as far as advancing. So we are going to be staying in stage 4. I think I mentioned last time that we are hoping to update our metrics. We'd like to include more information about numbers of people hospitalized and numbers of people in intensive care, because we do believe that is our best indicator right now of how severely this illness is impacting some Idahoans and how it might be affecting our healthcare capacity. Unfortunately, as I think you're all aware by now, we had a sudden switch of reporting systems that was from the federal level dictated to us. The hospitals have been working feverishly to make the transition, but we are still finalizing that. We actually have a meeting this afternoon with the Hospital Association and other partners, and hopefully we will be able to make that, be confident in our numbers. It looks like more and more of the hospitals are switching to this new system. I think we're going to be good to go, but we are not quite ready to make that a change yet. But I think next time we talk, we will have hospital data, more robust hospital data to include in our metrics, and we think ultimately there's going to be some really good information collected and reported. So with that, I will turn it over to Russ Duke, the director, to talk more about the local response here.
Well, good morning, and thank you, Dr. Hahn. Thank you, Governor. Central District Health is a 4-county health department, so we serve Ada, Boise, Elmore, and Valley counties. So we had our first case in the state of Idaho on March 13th, as you may recall, reported here in Ada County. And since then, we've learned a whole lot more about this disease and the things that we can do to prevent transmission, or at least slow it down. As the governor mentioned, face coverings is really key to that effort. So I also want to say how much we have appreciated the leadership and also the guidance that we're receiving from the governor, the Department of Health and Welfare, Director Jepson, Dr. Hahn, and their team in helping us manage this at the local level. So as was mentioned, that transition is occurring. So what does that look like? So local public health districts are governed by a local board of health, and the local board of health is appointed by county commissioners. So we're not state agencies, we're accountable to our counties. So now that the transition has occurred, and starting on June 24th was the first effective date of the orders issued by Central District Health's Board of Health. Those orders have subsequently been updated, and most recently, as a little over a week ago, was a mandate for face coverings in Ada County in public places. So why that's important as far as the local control, again, early on, there were a lot of challenges we were facing, namely personal protective equipment to protect our healthcare workers. We had no idea how this was going to play out here in Idaho. Now we have a much better idea, so this local control concept is very much supported by myself and by the Board of Health. And what that allows us to do is exactly what you're seeing playing out is Valley County, Elmore County, and Boise County, while they do have cases in all 3 counties, it's nowhere near what we're seeing here in Ada County. And a lot of that, we believe, is due to population density and community interactions. I also want to say that the board is not doing this essentially in isolation. We have a very public process. We accept comments from the public basically throughout the week with a cadence now of weekly board meetings. Our boards had typically met 7 times a year. Now the plan is they'll be meeting weekly on Tuesdays at 4 p.m. from now till the end, at least the end of this calendar year. So during those time periods, there's an opportunity for the public to provide comments, which we receive hundreds of comments each week, and those are shared with the board 24 hours in advance of the board meeting so they can review those and help guide the decisions that they will be making. The other thing I want to mention, as has been mentioned, is the importance of making sure that our schools are prepared to provide a quality education to our students while doing that safely. So there's still some of the fine details being worked out right now, but through the leadership at the state level and with input from the 7 local public health districts, we have a really solid plan in place. It's just a matter of figuring out the the metrics that we're going to be using to determine the various categories. So the public is probably aware if they've reviewed the Idaho Back to School Framework. There's Category 1, Category 2, and Category 3. Fortunately, we still have almost a month to refine that and to get those decisions in place. But our goal at Central District Health is to make sure that the over 75,000 students who will be going back to school here in a matter of a few weeks are able to do that, whether it be online or a combination of online and in-person classroom setting. So the last thing I was going to mention is the upcoming board meeting, which is on Tuesday, as I mentioned. The primary topic we'll be talking about back to school, and we have the president of the State Board of Education, Debbie Critchfield, who will be joining us for the start of that meeting. And then there'll be a discussion about the orders with some clarification on the application of face coverings in the school setting. So again, really appreciate what I'm seeing in the community here in Ada County, as well as our neighboring counties. We're starting to see a lot more compliance with face coverings, and that's a really good indicator, because bottom line, I get it. It's not super comfortable to wear face coverings. It's different than where we were certainly 5-6 months ago. But I feel like it's absolutely essential if we're going to continue to manage this disease and maintain some normalcy to how we prefer to live in this great country and in this great state. So with that, I'll be happy to answer questions along with the governor and Dr. Hahn. I wasn't sure if Director Jepson, if you were going to make comments. Okay.
Thank you, Russ. Okay. Well, that was a quick one. Thank you. Betsy, I knew you wouldn't be bashful.
Governor, you talked about the collaboration with the health districts and how that's now the right way to approach this issue. And you also talked about the wearing of masks. But in several parts of Idaho, including southwestern Idaho and North Idaho, we have had health district board members making public statements and statements on social media that COVID-19 is a hoax, that wearing masks is dangerous and should not be required. How do you square that with these being the leaders who are going to help us solve this?
Well, our system, and Russ alluded to it, about how people are selected to serve on these health districts that have been around for 50 years. The law passed in 1970. That's the way the law is in Idaho. Health districts are either made up of county commissioners or appointed by county commissioners, and that's state law. So it's just like, once in a while the governor goes off the rails, and that's the result of the electoral process.
So how do you plan to respond to this?
Well, we just continue, and occasionally I defend some of this because, look at where we were on masks. Look at the, it's a foreign concept in the United States of America. For those of us that have the great privilege to travel internationally, we know that in other countries it's been a norm, but it hasn't been here. But originally it was, originally there was not the abundance of these little critters around, and it was all about saving N95 masks for people in the healthcare field. Today, we know more and more. In fact, there's new science coming out almost every week about the efficacy. For a long time, it was just these masks are to create me from droplets or aerosol from getting to you. And now we know there's more and more evidence that it also protects the person that's wearing the mask. So in defense of people that have been skeptics of it, I say, this, and I think I've said this at almost every press conference, there's a reason this is called the novel coronavirus, is because we're learning more about it every day. But today, and that's part of the reason that we're going around today, the evidence about the efficacy of face masks is just way higher than it was before.
A question from
Well, I would add that the evidence I'm getting back from some of these areas where they don't have mask mandates is the percent of the population is wearing masks is going up. We all know what's taken place in a lot of the retailers, both large and small, about implementing, from a private business standpoint, a mask mandate. All of the, like with Betsy's question, the collective volume of evidence, behavioral change, I think is going to help. But at some point in time, if people don't voluntarily do it, a mandate, as this health district did here, is very important. The critical thing for our coronavirus working group is always this red line, statewide. That's what we're worried about. And if that's jeopardized, something may have to happen. Yeah, Keith.
Does that mean you issue a statewide mask requirement?
I doubt that very much. You know, what always works best is for us to work with the existing laws, which is the health districts, and do all we can to give them the information to do the right thing. And you know, I believe simultaneously to where we are right now, they're talking about a strong recommendation. Is that fair, Chris? A strong recommendation, but at some point in time, a mandate may be necessary as the leaders of this health district determined.
So you're leaving it to the health districts still?
I think still is a critical word. Yeah, John.
Question for Mr. Duke, actually. Is there a metric or a point where schools in this health district would not be allowed to meet in person, or if they did get started, they'd be pushed back to go online?
So that is a great question, and one that we've been discussing for quite a while now. So the metrics are being developed as we speak. So we're hoping to have those out by next week and make them more publicly available, because that is the debate. Are we in category 1, category 2, or category 3? I'll tell you, we're not in category 1 with none to minimal. So trying to get that basically dialed in and then make it known to the public. I understand there's a sense of urgency to that. With that said, the category that we're in today could change. We've issued the orders here for Ada County. I wouldn't say we're seeing a decline in cases, but it certainly did not continue to rise as it was before the initial orders were issued back on June 24th. So I'm encouraged by that. I'm hopeful over the next few weeks we'll see the impact of the face covering mandate. And again, that's my plea to the public is this is a really big deal with school starting in just less than a month from now. And anything that we can do to help drive down those numbers and get kids back to school is what our main objective is.
Governor, I got 4 questions from Scott Logan.
His limit's 3, but we'll see.
All right, I'll let him know. So the Labor Department director apparently told him the backlog of claims is all caught up. Does that mean the worst is over, and what's the next challenge?
Oh, thank you. Yes, the worst is way over. There's always a backlog. And as we've seen, you know, something that didn't even exist 5 years ago are all these cyber invasions of people on the dark web that go out and find the personal identification of people in Idaho and try and make false claims. There's federal law and there's state law, and our state laws are very, very strict. And that was part of the delay in us getting that out, as I've said over and over, you know, it was not satisfactory to us at all to have these big delays. But to burn through that 46,000 claim backlog, and now we've got, you know, 600, but a lot of those are very complicated, and we think some of them are probably fraudulent. There were 9,000 that were originally flagged as being possibly fraudulent. We've made some more changes, and we're in a way better place than we were before.
Okay, next question. Scott says he still hears from people unable to get in touch with anybody at the Labor Department even since
That can't be right. If they're calling first thing in the morning when the phones open up, but to my knowledge, I get a dashboard report on how the call center's working, but I do know that it's better to call in the afternoon, and they ought to reach out to us, because I think there's 120 people in that call center. Marissa, does that sound right to you? I think there's 120 people in that call center, and the intent was to be able to handle all those.
Is there a timeline for when the brick and mortar labor offices will be back on?
Well, we closed a lot of the brick and mortar labor offices prior to this, and in fact, a lot of the brick and mortar were just exactly what you said, brick and mortar. All the applications had to be online. What we may do, because we pulled a lot of them in to handle these claims, is we may get them out doing what they were doing before and go into remote areas, whether it's a library or courthouse or to help people. We've always done that. We've always sent a strike team into an area if we have a major employer lay people off, and we may do that. Hopefully we won't have any of those major layoffs, but there's nothing to preclude that from happening. Our goal was to get that backlog caught up, and we did.
Okay, last question. Apparently federal aid for small businesses, including farms, it's gonna be running out here. Is the state keeping an eye on that and thinking about stepping up and helping?
Well, our CARES Act, my coronavirus advisory group has looked at some of those programs. As you all well know, there's a lot of big discussions going on in Washington. When we were back there last week, we had conversations with Treasury and some of the members of the delegation. I think those business programs are going to be probably in that next program that's out there. I was on a call with the national governors yesterday. We know there's a significant amount of money that's going to be available for education in the new bill. Congress does what Congress does, but we're sensitive to it. We've got some agricultural entities that are doing great. There's others that have really been stressed, particularly if what the products that they provide go into the white tablecloth industry, that they're in really tough shape. But some of the other ones, the dairy industry, which started out this pandemic really handicapped, we've got record high cheese prices today, so they're doing much better. Yes?
I have a question for Dr. Hahn, actually.
Good.
Dr. Hahn, when we get the new data from the hospitals, how will it change the criteria that Idaho has to meet to move stages or even schools? And then also will high flow oxygen be one of those new criteria?
Yeah, so we have to see the new data first to make sure that we understand our numbers. We understand with the new system, and again, I'll learn more about it today, but we're actually going to get more information than we were getting in the old system to our understanding. For example, we've been told that we might actually get information about how many staff are out at the hospitals, like not able to work, either they're sick or they're in isolation. So we don't know yet how we're going to incorporate those. We want to see them and see the quality of it, make sure that it's good data that we can count on, and then we'll decide how to include them and how it might change our actions. So I don't have an answer quite today yet for that. And I'm sorry, you asked me something else.
It's about high flow oxygen.
Oh, about high flow oxygen, yeah. So to my knowledge, and again, I'll know more today, but I don't believe we're collecting information on use of high flow oxygen from the hospitals, to my knowledge. We still are collecting the ventilator data, which, ventilators are not as important as they were at the beginning of this, but we still do have plenty of folks going on ventilators. But I'll look into and see what else we're collecting that's new, and we will certainly incorporate anything that we think, especially something that might be something we could run out of, right? Because we want to watch and make sure if there's something that's in short supply. Our antiviral remdesivir is another thing we have not been formally tracking. But our sufficient supply of antivirals could be another thing we might include.
And then do you just have a comment on now hospitals saying they don't want people to go to the emergency departments to get tested?
Yeah, so that is a great reminder. I mentioned that we are seeing more people in our emergency departments due to COVID-like illness, but I know that the hospitals are asking people, if possible, not to go to the emergency department if they're sick with COVID-like symptoms, to call ahead. Many of them have alternate screening sites and testing sites to try to keep the emergency departments, as safe as possible. On the other hand, we don't want severely ill people to stay away either, and to stay home. We want them to come and get care if they need it. Yeah.
Dr. Hahn and Dave were talking when we came in about our chart, and actually that line of question was very appropriate. Our goal from the very beginning has been this line, but what's happened is, as the science has evolved, as our PPE inventory has gone up, as other things have happened, what determines whether we have anybody that can't get care has changed. And I know for those of you that live and die by the statistics that come out at 5:01 every day, our goal is to take and aggregate all that data to make sure that we've got that healthcare capacity. And it will change, and I know it's frustrating if you're watching one number and then the number changes. But I just want to remind everybody and assure everybody that the coronavirus working group that both Dave and Dr. Hahn serve on, our goal is to make sure that we don't have anybody above that red line. And so it's changed as your questioning reflected.
A question from Kevin from Idaho Ed News. You mentioned the concerning spread of coronavirus in Ada, Canyon, Kootenai, Twin Falls, and Bonneville counties. Could schools in these communities safely reopen at this current rate of coronavirus spread?
Well, I think the answer is it depends. It depends upon what's taking place. Russ just alluded to the fact that, the mask mandate here or the use of masks voluntarily in a lot of those other areas, every time these numbers go up, the public gets more aware of it. When the public gets more aware of it, those big super spreader events go down. People on their own initiative do the right thing, as we do, as we spend our time talking to you to try and encourage people to do the right thing. So I just can't say. There's a number that's out there. We want the default for kids to be in school, but at some point in time, if parents aren't comfortable sending their kids to school, educators aren't comfortable going. But I will remind you that there's brand new evidence just came out in the last literally 10 days, some of it in a McKinstry report, some of it was research out of Europe and Korea, that these young kids under 10, the transmissibility from them and the effect on them is much lower. So I'll spend some time talking to the state board about how do we take some of that new evidence and say, maybe these older kids, where we think there's a lot more transmission, we'll roll them back, and the younger kids who really need particularly the help in reading and some of those other fundamentals will be in school. So those are all things that are in play, given the continued advancement in what we know about the coronavirus. Is this Scott's 15th question?
No, this is
Okay.
my news director. Okay, so if school started tomorrow, we would be sending kids back, we would be playing sports based on where we're at right now.
Well, the state board has deferred to the state high school athletic association to make those determinations. One of the things, the last document I read from them, it depends upon the sport. Wrestling is different than cross country. Just figure that one out. It shouldn't be any surprise. So, the high school athletic association, the districts, and the administrators are all working on what sports, given where they are, and that's, I think that's the policy that's out there right now, and I think that's going to take place on sports.
What would have to happen for the state to mandate masks?
I think I know I said last time, never say never, never say always, but we've still got 2 counties with no confirmed cases, and we've got a lot of counties where there's zero positivity in the testing. So if we had to have a statewide mask mandate, it would be it would be what it's been all along, a real risk of this taking place statewide.
Governor, question from James Dawson of Boise State Public Radio. He says, Governor, I think it's fair to say a lot of Idahoans are skeptical of the government. How do you convince people about the science of face coverings or the safety of a vaccine if and when it's available in the face of such mistrust regardless of facts?
Oh, so profound. The people in Idaho are skeptical of government. And I mean, it's a higher burden on the health districts. It's a high, if these health districts are determined by their local county commissioners that people know, they see, they talk to. I was on a call yesterday with all the House and Senate members. We were on a call yesterday with the hospitals. We have conversations with the cities, with the tribes, with we just continue to outreach. I get that. James's point about the skepticism in Idaho is very high. So it just is a bigger burden on us that have been given the great honor to be in leadership, that we have to work harder to get the message out. Joy.
Last week there was a White House report that got out called the Red Zone Report. Idaho is in one of these red zones. First, did you have any conversations about that report when you were in Washington last week? And second, what do you make of the report and suggestions or recommendations that Idaho should roll some regulations back?
Well, I mean, I think that's, you just heard Russ Duke talk about what's taken place. The Vice President's Coronavirus Working Group that we were on Dave and I were on a call with Monday. We're constant communications. Dr. Hahn, how often do you have a call? Daily or with the, we're constantly looking at these numbers, and we're trying to refine these numbers as best we can. I know a couple of the classifications are by surface area, and I can tell you the surface area of Hawaii County is a lot different than the surface area of Boston and Massachusetts. If you've got a 15% positivity in Boston, you got a 15% positivity in Hawaii County when it shows up on the map. It may look like a great big red blob, but there's a block in Boston that has the same population as all of Hawaii County. And there's a little more distancing. Yes?
Governor, what exactly would trigger, the state considering we're actually going back to stage 3 or maybe stay-at-home workers? What exactly would have to happen for that to even be considered or even implemented?
Well, I won't turn around this time. I'll just refer to the graph right behind me. Is always going to be an indicator. But, I think if we were going to do something, I think it would look different. What we know about this coronavirus continues to change, that the standards we used for our 4-stage opening originally, that as we learn more about the coronavirus, some things that were in one might move down. And then we have all those, I don't know how many pages of guidance do we have? Many. All those pages of guidance, that might be part of it. But I don't think we go 1, 2, 3, 4, 0, and then 4, 3, 2, 1. I think it would be maybe bits and pieces where our public health officials say, here's where your biggest problem is, and we'd be flexible. Yeah, Keith.
You said you're visiting 4 health districts today. What are the other 3, and what's your primary goal in going to these?
Well, part of the reason is they're having meetings, and that's why we didn't want to interrupt their meetings. So, but our goal is to say what I thought I did and what Russ did is, this is how this is going to work now, and we're all in. Dr. Hahn, Elke, Dave, the state, we're all in trying to provide the health districts with all the resources, all the statistics, all the information they need to make the right decision, and encouraging them to do that. Yeah.
For Director Duke, actually, we've had a lot of parents reach out to our newsroom asking about masks in school, and specifically in Ada County. There is a mask order, so I'm assuming students would be expected to wear masks in the classroom where there's that order. Beyond that, though, outside of Ada County, would it just be on the schools to ask staff and students to wear them?
Yeah, so the first wasn't a question, but a comment about Ada County, and you're exactly right. The orders do apply. They're going to provide clarification at the meeting on Tuesday, and I think I failed to mention those are streamed live through YouTube, so it's a good opportunity for the public to watch those. As far as the other counties within our health district, at this point in time, the case counts remain relatively low for all 3 counties, so it would be a recommendation and encouragement as a means to reduce the transmission, but not part of a mandate again at this time.
And for parents asking, what is the age cutoff for who needs to wear a mask?
So the age cutoff in our order that would apply certainly to school-age children is under age 2 would not be expected to wear a mask. 2 and older would be expected to wear a mask or a face covering.
Okay. All right, thank you very much.